my name is Liando, and today I will be talking about anticoagulant therapy to treat thrombosis. So the topic that I'll be talking about today, it revolves around the circulatory system. So this first slide is just a quick overview and its function. So it's a network that runs throughout the entire body, and it's made up of the blood vessels in which it moves, and the heart that drives that movement as some kind of like a central pump. Now, this movement of the blood around the body, it serves to supply the tissues of our organs with the necessary nutrients to perform their functions, glucose, oxygen, ions, etc. And once those nutrients have been used, the metabolic waste is also removed by the blood. They get taken to the kidneys or lungs to be expelled. So the other function of the circulatory system is that the blood transports hormones to target organs, tissues, and cells in order to maintain homeostasis in response to any sort of changes in our environment. And lastly, the system also protects us from foreign substances like the white blood cells against pathogens. And the basis of this presentation is the system's ability to protect us from blood loss by forming clots to cover any damaged vessels. So there are a number of physiological changes that occur when we damage our blood vessels, and they occur quite rapidly to prevent excessive loss of blood. The main stages that occur in a clot formation are: number one, vascular spasm. Second is the platelet plug formation, and lastly, coagulation. So what happens in those stages? When the blood vessel is damaged, there is an immediate reflex for the blood vessel to constrict. So this is the vascular spasm. It's initiated by the local sympathetic pain receptors, and this is to make sure that there is less blood traveling through that vessel, so that ultimately we limit blood loss through that damaged site. After that, platelets in the blood then form a plug at the damaged site. Okay, it's initiated by a glycoprotein called the von Willebrand factor that can be found in the plasma. The platelets adhere to the damaged site on the vessel. It changes form to become sticky, and they degranulate. Then this releases chemicals that assist in recruiting more platelets and also vasoconstriction. So you've got adenosine diphosphate, ADP, attracts more platelets, serotonin and thromboxane, A2, they vasoconstrict the vessels further, and thromboxane A2 also assists in regranulation and platelet aggregation. So the recruited platelets, they then do the exact same thing. So it becomes like a positive feedback loop. And lastly, clot formation. The clotting factors are then activated through a series of coagulation cascade events that eventually form fibrin, cleaved from fibrinogen through the action of thrombin. Now, fibrin then integrates itself into the platelet plug to form a mesh-like structure, and it holds the plug in place, and it traps red and white blood cells to form that clot. So we know that that a clot is an essential part of the defense mechanism of the circulatory system. However, there are cases when this becomes quite problematic, and it happens when a clot forms in the blood vessels without injury or trauma, and it forms a thrombus. There are multiple types of thrombosis, which we won't be going into too much detail, but some of the well-known ones are deep vein thrombosis, pulmonary embolism, that's when a part of the clot is formed elsewhere in the body, and breaks loose to form an embolus and travels through the bloodstream into your lungs. And also arterial thrombosis is another one that usually occurs in atherosclerotic arteries. So what can we do to treat thrombosis? So there are multiple treatment options, each targeting different pathways and substrates and enzymes, but they all ultimately aim to ensure that a clot does not form. So we have the thrombolytics and the antiplatelet agents, but today we'll be focusing on anticoagulants. Now, the two main categories that we will be discussing are vitamin K antagonists and non-vitamin K antagonist anticoagulants. We shortened that last one to NOACs. Now, NOACs are quite novel. So the direct thrombin inhibitor and the direct factor Xa inhibitor, they're quite new. But studies have shown that compared to vitamin K antagonists, they have less drug interactions, a faster mode of action, fixed doses, so with less monitoring and dose adjustments, and this simplifies treatment and it improves adherence among patients. So the first one we'll talk about is the vitamin K antagonists. Okay, so warfarin is probably one of the most well-known anticoagulant out there, associated with its use as rope poison. Now the clinical version is sold as coumadin, and it exists as two isomers, R isomer and S isomer. The significance of this involves its pharmacokinetics and its metabolism. So they're used to prevent systemic embolism, stroke brought about by atrial fibrillation, and venous thromboembolism. And the way it works in the liver is that warfarin targets an enzyme called vitamin K oxide reductase. And as the name implies, it reduces vitamin K epoxide to vitamin K, its reduced state, which is needed for carboxylation along with oxygen and carbon dioxide and gamma glutamyl carboxylase to activate those vitamin K dependent clotting factors. This then oxidizes the vitamin K back to vitamin K epoxide, and this completes that cycle. So by inhibiting the reduction reaction, the clotting factors remain inactive. And that diagram in the slide just summarizes the whole reaction there. Contraindications to this treatment is hemophilia, any recent hemorrhaging, individuals with high risk of falling, pregnant women, and anyone suffering from liver disease. Adverse effect, of course, is bleeding. So now we move on to the vitamin K antagonist, non-vitamin K antagonist, and the first one we'll talk about is the direct thrombin inhibitor. There are two types, univalent and bivalent. Univalent inhibitors include dabigatran, malagatran, and argatroban, and they bind only on the active site on thrombin, while bivalent ones, the hiridin, lepyridin, and daciridin, they bind to the exosite 1 and the active site. And as you can see there in the diagram, exosite 1 is the substrate recognition site, incidentally. This ultimately inhibits the thrombin from cleaving fibrin from fibrinogen, and without fibrin, a clot lacks that mesh-like structure that holds everything together and what makes it clot. And similar to warfarin, adverse effects on this treatment option is bleeding. So the direct factor Xa inhibitor it's got multiple brands, sold as multiple brands, and each brand has different active ingredient. So you've got the rivaroxaban, apixaban, edoxaban, and most recently approved betrixaban. Now, indications are pretty much the same as direct thrombin inhibitors, but this particular medication, it's used more in patients undergoing hip or knee replacement surgeries. It acts as a competitive inhibitor to the clotting factor 10A, which converts prothrombin to thrombin, and ultimately, again, it inhibits fibrin formation. Bleeding is the most common adverse side effect, along with nausea, vomiting, and constipation. So the last slide here is just, it just summarizes everything that we've talked about. It puts everything all together. So you've got the warfarin on the left-hand side there, inhibiting vitamin K reduction from vitamin K epoxide. So all those clotting factors there, they remain inactivated. And then you've also got dabigatran on the bottom right there as a direct thrombin inhibitor, and just above it you've got the clotting factor 10 inhibitor. So all of that, it all ends in the inhibition of fibrin formation that holds the clot in place. And that's everything about anticoagulant therapy for thrombosis. Thank you.